Be honest, have you ever looked at your health insurance card or plan document and thought, I don't even know what this even means? You're not alone. Insurance paperwork can feel like it's in another language. The truth is, health plans use a lot of specialized terms, and that confusion can cost people money. But once you understand a few simple concepts, you'll see that health insurance isn't magical. It's a system of payments and protections. By the end of this module, you'll know what every key term on your plan actually means so you can predict your costs, plan smarter, and take control of your healthcare and your wallet. For today's agenda, we have premiums, your monthly subscription fee, deductibles, what you pay before insurance help, copay, your flat fee at the door, coinsurance, splitting the bill with insurance, out-of-pocket maximum, your safety net, how it all works together, common insurance questions and mistakes, quick review of key terms and big picture scenarios, final pro tips, and closing and next step. Would you rather pay less every month, but more if something happens, or more every month for peace of mind later? How did your last plan choice balance monthly costs versus worst case protections? Premium, your monthly subscription fee. Let's start with one thing you pay every month, the premium. Your premium is like a subscription fee to keep coverage active. You pay it whether you use care or not. Lower premiums usually mean you pay more later when you need care. Higher deductibles, cost share. Higher premiums usually mean you pay less later when you need care. Now, here's an example. Maria picked a $200 a month plan with a deductible of $6,000. Jamal chooses a $400 a month plan with a $1,000 deductible. When Jamal breaks his ankle, he owes far less upfront because his plan starts helping sooner. Maria saves month to month, but one accident wipes away her savings. Now, when you pick a plan, think long term. Ask, do I want to save money each month, or do I want peace of mind if something happens? Do you know your current deductible and when it resets? If you have a $1,500 expense tomorrow, how much would insurance cover before you meet your deductible? The deductible is how much you pay out of pocket before your plan starts sharing the cost. If your deductible is $1,500, you pay the first $1,500 of covered medical bills each plan year. After that, your plan starts the sharing of the costs via copay or coinsurance. Now, here's an example. You visited urgent care for a broken finger and an x-ray for $300. Later, you need $200 of lab work and a $1,000 ultrasound. Those first 1,500 come from you. After that, your plan begins to help. The good news, under federal rules, most non-grandfathered plans must cover many of the in-network preventative services like annual checkups, ACIP recommended vaccines, and certain screenings without cost share, even if you haven't met your deductible. Now, did you know your deductible resets each plan year, often January 1st, but some employers use a different start month? The deductible is your starting line. Once you cross it, every bill gets easier. Which service on your plan have a copay versus apply to deductible? Have you ever been surprised by a lab or facility fee after paying a copay? Copay, your flat fee at the door. It's small, predictable, and a fee for certain services. Now, here's an example of these fees, and it can vary by plan. So, $25 for a primary care visit, $50 for an urgent care visit, $10 to $40 for many prescriptions. You usually pay the copay at check-in or pickup. Other services provided at the same visit, like facility fees, procedure labs, imaging, may still be a separate cost depending on your plan. So that's very important to know that portion. Now, here's something to think about. Think of it like a bus fare, a flat amount that you gets you on board. Other add-ons like labs or certain things may be extra. Copays often don't apply to the deductible, but they do count towards the out-of-pocket maximum, which we'll go over later. Pro tip: if a benefit reads no copay after deductible, you'll pay full amount charges until you meet the deductible. Then the copay applies. Copays are a small price that keeps big costs predictable. Just remember, add-on services can be billed separately. After you meet your deductible, do you know your coinsurance percentage for big ticket care? How much would 20% of a $3,000 service impact your budget? Coinsurance, splitting the bill with insurance. Once you meet your deductible, you or your plan typically split the cost through coinsurance. Coinsurance is the percentages, commonly 80-20, 70-30 plan patient. Now, here's an example. You met your deductible and now you need a $3,000 MRI. With 20% coinsurance, you'll pay $6,000 and the insurance covers $2,400. Now, did you know coinsurance most often apply to higher cost services like hospital stays, surgery, imaging, specialty treatment, but exact rules differ by plan. Now, even small percentages add up fast. Ask for the price estimate before scheduling. What's your current out-of-pocket maximum for individual and family? In the worst case scenario, do you know the exact dollar amount that caps your year? Out-of-pocket maximum, your safety net. This is your financial life jacket, the out-of-pocket maximum. It's the most you'll pay in a planned year for a covered in-network service. Once you hit it through deductibles, copay, coinsurance, your insurance pays 100% and you're covered. In-network costs for the rest of the year. Now here's an example. You have a $7,000 out-of-pocket maximum. You're in an accident with $40,000 in bills. After you paid $7,000 in allowed shared costs, your plan covers the rest of that year. Here's a pro tip. Always compare out-of-pocket maximums. It's your worst case number. The out-of-pocket maximum is your stop loss line. What turns a huge bill into something you can recover from. Looking at your own plan, can you map out which cost hits premium, deductible, copay, coinsurance, and out-of-pocket maximum across a typical year? Where would you expect your biggest expense to land? How it all works together. You pay your premium each month to keep coverage active. You pay copays for certain visits or drugs. Bigger services, tests, procedures go towards your deductible. After your deductible, you pay coinsurance on covered services. Once your total out of pocket spending hits the out of pocket maximum, your plan pays 100% of covered in network costs for the rest of the year. Now, here's an example. Jessica pays $350 a month in premium. In March, she pays $1,500 to meet her deductible. In April, she owes 20% coinsurance on a $200 bill, $400. By September, she hits her out of pocket maximum. A November procedure is then covered 100% in network. Now, did you know many never meet their out of pocket maximum in a given year? But knowing yours help you plan for the worst case scenario. When you see how the pieces connect, insurance stops being scary. It's just a step-by-step process. Which of these pitfalls have tripped you up before? In networks, preventative care rules, underestimated coinsurance. What's one rule you'll double check on your plan tonight? Common insurance questions and mistakes. Even experienced members get tripped up. Here are the top 5 pitfalls. 1. I picked the cheapest premium, I'm saving money. Not always. Low premiums can hide high deductibles and coinsurance. 2. I'll worry about network later. Out of network bills can be much higher. Some plans don't cover them all, except emergencies. 3. Preventive care isn't covered until I meet my deductible. For most non-grandfathered plans, many in-network preventative services are zero or free before the deductible. Out-of-network or non-ACA compliant plans may vary. 4. My plan pays 80%, so I'm safe. 20% of a larger bill can still be thousands. 5. I don't need to check my out-of-pocket maximum. That number defines the worst case exposure. Now, here's an example. Angela skipped her annual exam thinking it would cost money. It was a $0 or free preventative care, and her doctor caught prediabetes early enough to reverse it. Insurance doesn't reward guessing, it rewards knowing the rules. Could you explain these 5 healthcare insurance terms to your friend without looking? Which one still feels fuzzy and needs a second look on your own plan? Now, here's a quick review of key terms. Premium, monthly price for coverage. Deductible, what you pay before your plan starts cost sharing. Copay, a flat fee for certain services or drugs. Coinsurance, your percentage share after the deductible. Out-of-pocket maximum, the most you'll pay in a plan year for covered in-network care. Now, here's a pro tip. Look at all these 5 together before choosing a plan. The monthly premium means little without the deductible and the out-of-pocket maximum besides it. Where in the year do your healthcare costs usually spike? Early deductible phase or late after meeting it? How would planning for that timing change your budget? Now, here's a big picture scenario. See how it plays out across a year. January, you pay for premium, no major care. March, flu at urgent care, $50 copay. An example. May, work injury, MRI, $1,200 goes towards deductible. July, minor surgery, $5,000. Plan pays 80%, you pay 20%. So you pay $1,000 because you met your deductible. October, accumulative spending reaching out-of-pocket maximum. December, $600 follow-up is covered 100%. in network. Once you know the steps, you can plan and avoid surprises. What's one action you can take this week to lower costs? Confirm in network status, request an estimate, or set up a health savings account, which we'll go over in the later modules. Now, here are some pro tips. Keep costs down with these insider moves. Use in network providers. Out of network providers can be far pricier and may not be covered. Ask for an estimate and the cash price. For example, for simple shoppable service, some providers offer a self pay rate. Ask how that interacts with your insurance before choosing. Use a health savings account. A health savings account eligible high deductible plan. Contributions are pre tax, gross tax free, and can be spent free on qualified medical expenses. Review your explanation of benefits EOB. They show you what the plan paid and what you owe. Dispute errors quickly. Now, did you know many billing errors get fixed after one phone call? Which term would you look up on your plan right after this? Deductible, coinsurance, or out of pocket maximum, or all of the above? What matters most for your enrollment, lower monthly premiums or stronger worst case protection? It's really up to you. Congratulations, you now know how to speak the language of healthcare insurance. You know what your premium covers, how your deductible works, what copays and coinsurance really means, and how your out of pocket maximum protects you. In the next module, we'll put this knowledge together into action, how to pick the right plan for you and your family, balancing cost, coverage, and peace of mind. Understanding the terms is step one. Using them to make smart choices is step two. Thank you. I will see you in the next module.